everyone. My name is Anna and this is Jules O'Neill, and we are the Wayfinders for the Cornwall Memory Cafe Network. So here we are. This is the 5th podcast of the Wayfinders for the Cornwall Memory Cafe Network, working for Disability Cornwall. And we are privileged and so honoured today to be interviewing Dr. Allison Hibbert, who is the Cornwall and Isles of Scilly System Lead for Dementia. We're here today to talk to her, ask her, bend her ear about all things dementia and the vision for dementia care across Cornwall. So my name's Anna, if you don't know me already, Wayfinder, and Jules here as well, Wayfinder. And thank you, Alison, after your long day, to give us this time for us to ask you loads of questions.
My pleasure to be here. My pleasure.
So first question then is, we know that you're a GP. Why is this such an important area of work for you? What sort of led you onto this path?
Yeah, so I've been a GP with an interest in particularly older adults for the last few years, but this role really came about because 5 years ago Cornwall was noted to be an area that wasn't doing well in dementia care, that was underperforming, recognised by kind of NHS England as having some of the lowest sort of diagnosis rates in England. And so they created a role to have a GP lead working and employed by the commissioners, the health commissioners. And now our commissioning body is called the Integrated Care Board, and that's who really employ me and fund my role. But what does my role mean? Well, really,
yes,
over the years, it's become what I feel is a championing role for people living with dementia and their carers, and also those volunteers, those in professional roles, those supporting people living with dementia, championing for them too, so that to support them and enable them to carry out their work. We know in Cornwall that people living with dementia are quite vulnerable, and their carers, and you may have seen the Hear Our Voice report from Health Watch Cornwall, which was released earlier. It was earlier in the year. Time passes so quickly, but it gave us some feedback in Cornwall about how we need to kind of improve. And really, my role is around kind of championing and trying to drive forward those improvements.
Wow. So that leads on beautifully to what are those improvements then? What's the vision for dementia wellbeing, dementia care across Cornwall in the next few years?
So ideally what we want to see is, I suppose, go back to what's the NHS England well pathway for dementia. So are we preventing dementia well? And we can prevent dementia. That's probably a topic you want for another podcast, actually. So are we preventing dementia well?
Yeah.
Are we diagnosing dementia well? Are we recognising dementia? And those people that are diagnosed, are we treating them well? Are we supporting them well? Are they being supported to live well? And sadly, we do know that dementia is a long-term and can be a terminal condition. So are we supporting people to die well with dementia? So the whole journey, are we supporting people well? And what we want to make sure is that people can receive a timely diagnosis. And then after a diagnosis, they're offered support, and support that's tailored to their needs in a personalised way, really.
Wow, yeah, that sounds really amazing, and I'm sure everyone is looking forward to seeing these changes. So one of the questions I get asked a lot at the memory cafes is, why do some people get a diagnosis through their GP and others have to go through the memory assessment services or memory clinic? What's the difference?
Yeah, so GPs can diagnose dementia, but GPs are generalists, but some may have had training and have the skills to be able to diagnose dementia. It's easier to diagnose a dementia if it's a more common sort of standard presentation. So if somebody's presenting with very obvious symptoms, there's not much complexity. It may be that they're a person that a GP could diagnose, but dementia can be a difficult diagnosis to make, and some people do need to be diagnosed through memory assessment services for a more in-depth assessment, sort of a longer sort of memory assessment. People might also be diagnosed during a hospital stay if they've presented in crisis. If people might find that we've picked up that actually underlying the crisis and the problems, the falls, or the reason they're not managing, might pick up that there's somebody with dementia. So you might be diagnosed during a hospital stay. People might be diagnosed during being seen in a specialist clinic, so Parkinson's service or neurology clinic or healthcare of the elderly. Most people are probably diagnosed through memory assessment services, but you will see that some people can be diagnosed either sort of in primary care. Most important thing really is that wherever somebody is diagnosed, that they are offered support afterwards. That's the most important thing to kind of note really, and to make sure that's happening.
So that's where my next question then would lead really, is what can somebody expect about the journey of their care once they've been diagnosed, or what do you esteem or hope to be able to provide going forward?
Yeah, so diagnosis is really the key to should be the key to unlock support. And people say that, why bother diagnosing dementia? We can't cure it. There's nothing you can do about it. But that's absolute sort of stigma and myth. And some of the sort of reasons for kind of diagnosing, basically, the first thing is understanding that once you understand what symptoms are, why somebody's having the symptoms, you can then start sort of supporting them. It won't change the outcome, but just by allowing kind of friends or family or loved ones to be able to even read up on the condition, can then show, and they can read up how they can support that person. And understanding that person's not behaving like that because they're being naughty or rude. They're behaving like that because it's an illness. They've got an illness, and so we need to adapt to help and support them. So diagnosis is really important from that aspects. So giving people information and signposting to where they can get information is really kind of key after a diagnosis. Making sure that a carer has support, and so making sure that that person's been signposted to the carer's service or carer's assessment needs that they may have. Often care and having somebody unwell can come with financial kind of costs, so it's making sure that people have had the right considerations around sort of finance, and that might be having benefits assessments or council tax or carers allowance. It's important to kind of think of those kind of aspects. Then it's sort of care planning, and that might be with a health care professional, support worker, kind of thinking about what matters to that person, what's important in their care planning, what signs to look out for when they're less well, and just sort of planning around what their care needs. Importantly, to make sure people have got access to kind of the National Institute of Clinical Excellence, kind of treatments that we'd expect people to be offered. Now, some dementias can be managed with medications called cognitive enhancers. Other dementias not, but actually we do know that something called cognitive stimulation therapy can help for people diagnosed sort of early on, and actually really having meaningful activities. So for the person themselves, and when I've chatted to a lot of people living with dementia, what really is important is actually that they're maintained to be as independent as possible. And they're still people, even though they've got a diagnosis of dementia, and actually to make sure that they get some enjoyment. So how can we help those people maximise their independence and still get some enjoyments? And I think some of it is around not worrying about the things you can't do, but being helped to do the things that you can. And so care planning really important. There's some medications that are not so good and can be harmful if you've got a diagnosis of dementia. So actually a medication kind of review, getting rid of medications that might be adding to kind of the burden on your sort of brain, making sure that people kind of know, so that making sure the diagnosis is on the GP kind of records, making sure that we look after the person. Care planning is important, and finding out what matters to the person, and some legal aspects important to think about. Something called a lasting power of attorney, and you can appoint that for health and kind of welfare. Again, that might be a good topic for one of your future podcasts, actually giving advice on that, because all too often I find people set up a power of attorney too late in the journey, really. And signposting to all of our wonderful activities in county: memory cafes, cognitive stimulation groups, sensory trust walking groups. We've got Admiral nurses to help carers. We've got Alzheimer's Society dementia advisors. We're really lucky in Cornwall to have a sort of army of people that are out there to support people, including yourselves, the memory cafes and the Wayfinders.
Oh, thank you. And what we've sort of experienced sometimes is that it's almost like the people can get a diagnosis and then they're on their own, and I sort of feel like it's almost like working at finding that bridge to know about that support. What do you think about that?
I think you're right. I think health and social care has become very challenged. I think it's not easy at the moment. We are trying to improve it so there's a clear pathway. What's happened at the moment is that we've got a growing prevalence of people living with dementia. So our prevalence is going up and up and up. We've never had so many people diagnosed with dementia in Cornwall. And actually what's happened is the demand has outstripped the supply of support. But we're hoping to see some investment very soon that means that we're going to have some more support out there for people so that everybody will know that they've got somebody to kind of support or handhold or have somewhere to go. So I'm hoping in a year's time that'll look a little bit better. Obviously that's difficult for people out there at the moment, but we are focusing on actually improving that support. In Cornwall we've got something called the primary care dementia practitioner service, and we're hoping to also build in some support workers so that everyone's got kind of support really. But I think looking at the local memory cafes is a good site, you know, always signposting to the memory cafe kind of websites. But I think there's also the Admiral Nurse service, and you can share some contacts with your listeners and dementia advisors. There is quite a bit of support out there. Navigating the system can be very kind of difficult really, and I think really if any of your kind of listeners are having a struggle, then getting people like you that are supporting groups to help is a good idea, you know, to sort of be advocates to help navigate through, and because you do have to be quite persistent. Health and social care is incredibly busy, and I think sometimes people with dementia, their carers or even elderly people, they just don't want to bother people. And they, I don't want to think like fuss, don't want to bother people, they're really busy. But absolutely, you're really important to us. You're the people we do want bothering us, because you're the people that we want to kind of help really.
They can also sort of feel
can be persistent.
Yes, and they can also feel overwhelmed that you get a bombardment of information, and so having someone like you were saying that's special for them to help them navigate through all those different elements really. And there's something you said earlier, and then I'm going to hand it over to Jules again. But there was something you said earlier about becoming dementia aware, and that vision of, you know, not just specialists but
the community, about getting the community and losing the stigma of the word dementia and those sorts of things.
Exactly, we've got to. I think people don't want to come forward for diagnosis because of the sort of stigma, but we need to make it okay for people to be living in Cornwall with dementia, to be okay to kind of have depression or autism or bipolar or schizophrenia. We need to make it okay and kind of take that stigma out of it so that people can get a diagnosis, but just sort of also be kind of supported. But I think there's a lot around the awareness that people sometimes don't realise how to talk to people or understand, and actually some of it is actually being a bit more sort of going back to basics really, kind of actually, you know, compassion, kindness. We can all be dementia kind of friendly and understand. What I was saying earlier was about one of my relatives actually, who I was quite shocked that when he had to be admitted to a hospital to be seen up at one of the acute hospitals, it was really challenging. The noise in the environment, in the emergency department, they didn't understand why I might need a drink. It was kind of like unlike why my relative Jean, she couldn't leave him, so she didn't get a drink because she didn't leave him on his own, and it was unsettling, and they moved him from different departments. And actually, really, it was just not a good environment, and really, we needed to get him kind of home, and it was just a really difficult kind of contact, really. And yet, in contrast, we had an experience where I got lost in our village because Eric kind of wandered. He used to like to walk, and we lost him one day, and we were all kind of panicking. But then we found him up the road at the garage, and the mechanic up there had obviously got experience of a loved one with dementia, and he'd just given Eric a cup of tea in a chair, and Eric was having the best afternoon because he'd like watching them fix the cars, and it was really sociable. And it was that, and it just jumped out at me, the difference between actually people understanding just how to reassure somebody, calm them, be friendly, and just know, oh, this actually, yes, this person's living with dementia, you know, just to be tuned in to what was happening and how to de-escalate and calm down, you know, the contrast. And that was somebody who just got that awareness in the community, compared to a hospital where you'd have thought healthcare professionals would know better how to talk to and how to look after somebody with dementia. But outstanding, really. But I think it shows that dementia's for everybody, and that we all could have, you know, sign up and have some sort of skills and dementia awareness.
Yeah, wow. So you did mention the PCDPs in one of the earlier questions, and that's something that a lot of our listeners ask me and Anna about. Should I have a PCDP? What is a PCDP? So does everyone get one, or how does it work exactly?
Yeah, so everybody living in their own home, in a private home, should be on a register for a primary care dementia practitioner. And as I said, at the moment, because of the growing prevalence, they're a little bit overwhelmed. And what we've tried to do in Cornwall is offer regular reviews. Now, the annual primary care and the GP surgeries will try and do an annual review with everybody, but we felt that that's not kind of enough. And so we have got a service called a primary care dementia practitioner, and they work at the interface between the GPs and the specialist services. As I said, I think we've got 18 in county. They're a bit overwhelmed because we've got you know, thousands of people for them to support. So we're hoping that coming online soon we'll have some support workers as well, so that people either have a support worker or a practitioner, depending on their kind of level of need. And then if somebody's got complex symptoms, or things are not going very well, or there's kind of a bit more kind of risk or complexity, then they might actually have a community psychiatric nurse from the community mental health kind of team, really. So what we're hoping to do is sort of build a sort of people can have access to somebody to support, but depending on kind of needs. So you've got a support worker, actually, if you've got complexity around your symptoms, and a dementia practitioner. But actually, if you're really complex and there's quite complex and specialist issues going on, then you've got a community psychiatric nurse. So we're trying to sort of build a bit of a pathway with a sort of stepped level. We're not there yet, but hopefully that will be. But really, having a diagnosis in the first place, and having that diagnosis sort of coded on the GP record, is really important. And I know that some of your listeners, they might not actually have felt like going forward for a diagnosis. They might know that they have kind of memory problems, but they haven't. So just encouraging people to take that step to kind of actually talk to somebody about a diagnosis, approaching sort of primary care. And we know that at memory cafes, there are people that come to memory cafes that don't have dementia. They might have mild cognitive impairment, they might have memory problems for other reasons. And often people say, well, where can we go for advice? And although the primary care dementia practitioners are for people with dementia, you can still approach the dementia advisors from the Alzheimer's Society. They will still support people and give kind of advice around memory problems, if memory problems are linked to other causes. But I would encourage everybody to make sure that they have sort of approached GP surgery to take the steps to get a diagnosis.
Excellent, thank you.
That was some good information, definitely.
That's some amazing information. So I've got one more question then, is or not question, it's a more of a statement, and maybe to get your opinion is, you know, we were sort of saying it's interesting that, you know, we've got so much knowledge, advertising, money spent on educating people about diabetes or cancer, and it just seems like you know, that dementia awareness doesn't seem to be a thing, or you know, you were sort of saying in these institutions or going into shops or different things, it's not necessarily a lot of education about it.
No, people are scared.
And I think that, I think we'd like to sort of champion a bit more. I think you're right. I think the awareness isn't out there, and I wonder if that you know, some of the memory cafes is having some local dementia champions in the areas. I think getting local communities to kind of raise awareness as well, I think.
Yeah. Wow. Anything else, Jules, you can think of?
No, I think we've got so much information off you. I think it's going to be really useful for our listeners to actually hear, you know, exactly how the things that should be happening, what they should be doing. Because I think sometimes people get very overwhelmed with all the information, all the leaflets, you know, so to hear it from the lead is fantastic.
Yeah. And we feel so grateful.
I'm sure we can. Yeah, I'm sure we can get. We've got lots of other speakers we can get for you to kind of come and help and do talks on if there's specific topics that people would like to hear about. Then I think that'd be really good to get some bite-size information to listen to. Lots of colleagues that can come along and help.
Awesome. Oh, thanks, Alison. It's been really, really fun, informative, and thank you so much for your time.
Sorry, I was hard to pin down. It's just been so mad recently.